Hey guys, welcome back to Nurse Catherine here. Welcome back to my channel. So, some of you might be like, wait. I just looked at the name of this video and it says you hate ER nursing, but you're an ER nurse, so what are you talking about? So let's backtrack a little bit here, back to when I was in nursing school. So when I was in nursing school, we had the opportunities to go to the OR, to the ER, mother, baby. We never did a nursing home, and just a whole bunch of other places throughout the hospital since I went to a hospital school. And with that being said, I got to experience the ER for the very first time. I was never in an emergency room prior to that I can even remember. So with that experience, I hated the ER. I didn't like anything about it. So when I was there, I watched the nurses, okay? And I come from a family of nurses, so I come from a family of bedside nurses. That is like my family's forte, is bedside nursing. So I've learned about bedside nursing my whole life. And when I was in the ER, I was sitting there watching the nurses and I'm like, okay, these nurses are just running in the rooms and then running directly out of the rooms. They're not even doing anything for the patients. I was very naive, bear with me. I hated it. I was like, okay, they're like just trying to get in and out as fast as they can. They don't even want to talk to the patients. They don't even care about the patients. This was 19-year-old Catherine in nursing school thinking, oh, I don't want to be that kind of nurse. I don't want to be like that person. So I hated it. I hated ER nursing, and I told myself I would never apply to be an ER nurse. So I didn't. I applied to be a med-surg bedside nurse. That's what I said bedside was, not realizing how naive I really was. But I wanted bedside. I wanted to sit there with my patients and be able to talk to them and actually get to know them and see them day to day, not just know them for 5 minutes and then, oh, they're going upstairs or I'm discharging them right away. So that's what I did. I did bedside nursing for 3 years. And then I was like, I'm sick of bedside nursing. I need something fast-paced. I need something changed. I don't like bedside nursing anymore. Bedside nursing, in quotes, guys. So I was like, well, I don't want to do ICU because that's still like bedside nursing. And I don't want to have that much of a responsibility. And I just didn't feel like I knew enough to be an ICU nurse at the time. So I was like, hey, why not apply to the emergency room? That seems like something that will get my adrenaline pumping, and that'll be a huge change from med-surg bedside nursing. So I applied to the ED, and look at that, I got the job, and now I'm an ED nurse, something I said I would never do because I hated it. And let me tell you, I will be the first to tell you, ED nursing is bedside nursing still, and it is not as awful as I thought it was in nursing school. So here's a tip for you guys. If you are in nursing school, or if you are in a different field of nursing looking to go into another field, don't close doors that you haven't even opened yet, because if I would have stuck with that same train of thought of, oh, I hate it, I hate ER nursing, that's not what I want to do, I wouldn't be where I'm at now, and I love my job now. I love ER nursing. I love how fast-paced it is. I love that it's bedside nursing in a different way, and I don't have to spend days upon days with these same patients, and I'm constantly seeing something different. It's getting my adrenaline pumping. I know a lot more now from being an ER nurse, and I'm taking care of high acuity patients. I always said I never want to be an ICU nurse, but being in the ER, you're taking care of ICU patients before they even go to the ICU. So it's kind of the best of all worlds. You get that ICU training, you have your med-surg training, you have your emergency medicine training. It is really cool, guys. So do not shut doors before they're even opened, because if I did that, I wouldn't be happy where I'm at now. If you have a similar story, please comment below. I want to hear your story. Did you start in a field of nursing that you were like, oh, I love this, and I definitely don't want to do mother-baby or labor and delivery or pediatrics, and now you're ending up there because you found out you actually do want to do that or you love it? So shoot a comment below. Make sure to like this video. Also, don't forget to subscribe and share as well. I hope this can break up the monotony of your days during quarantine. If you guys have any other questions, please comment below. Also, be on the lookout for Tuesday's educational video. And also, of course, happy Easter weekend.